Hello, everyone. This is Dr. Valerie with Healing Wings Dental. Today, I have a good friend, Dr. Chi Emba. And what we're going to want to do today is talk about dental anxiety. It's a real thing. A lot of people experience it. And so we're going to kind of like dive into that subject. But before we do so, I would like for Dr. Emba, please, I know that you would do yourself the greatest justice by introducing yourself versus me doing it. So please introduce yourself, Dr. Emba.
Hi, everyone. I actually like to be known as Dr. Chi. I think there's a power in it. I'm following Madonna, okay? So that we go by first names.
I like that.
Anyway, so I am Dr. Chi, and the name of my practice is Chi Family Dental. And Dr. Mukanga was actually a co-worker of mine. I went to dental school in Dallas, and we worked for the same corporate office, and that's how we knew each other. And we have a saying. What is that saying, girl? Is that even a thing?
You love that. Is that even a thing? Yes. Yeah.
All right. So today I'm so excited to be here. I'm so excited that she has me on her show. And so I'm originally from Nigeria. I'm a mother of 5 incredible children. And I have gone to a lot of school. I went to graduate school, and then I went to dental school. But at the end of the day, I feel like God has called me to be a dentist, and I didn't get here as fast as I should have. But this is where we are, and I love what I do, and it's just an exciting place to be, helping patients. And so the topic today is dental anxiety, and I kind of wrote 2 books about it. One is a workbook, and the other one is an actual book, which is the one that she has. And I'm so excited to be here today. That one. I'm so excited to be here today.
Awesome. So you said you went into many things prior to actually landing into the field of dentistry. What actually motivated? I know that you said it's a calling, God called you to it. What was there any other motivation? Like, how did you, tell me a little bit about that.
So typically in Nigeria, and I think most African countries do it, it's just that when your parents or your family feel like you're smart, right? Everybody wants you to be a medical doctor. It's like, they just call you into it without you volunteering, right? So I had wanted to go into medicine. But then when I came to this country, I had too many kids. So when the kids started coming, I just knew that the medical doctor thing wasn't going to be the thing for me because I needed to stay home and raise them. So I wanted to be a college professor, and I did that for like a quick minute. So I went to Baylor College of Medicine. I was doing a PhD in biochemistry. Oh, wow. But one day, and it's just there's a whole lot of story that would take a whole day, but there is a woman, a female dentist by the name Dr. Pham, and I'll shout out to her. She's the dentist at Lexington Dental, and she told me I was going to be a great dentist.
Wow.
And so she motivated me to go to dental school. She did not only motivate me, she put her mouth where the money was, and she helped me apply to go to dental school right in front of her office. And she said I had a good GPA. I had a 3.92 GPA at this point. And she said, you would be a great dentist. And I said, and at this time, I hadn't even gone to the dentist myself. I had a fear for dentistry. In fact, I had a fear for a whole bunch of stuff at this time.
I see.
So I took her word, applied, and I applied to the 3 Texas schools. And I was in Houston at this time, which is still where I am. And so I got into, so you use one dental school application for the 3 Texas schools. I got into San Antonio, I got into Dallas, and I didn't get into the one in Houston, which is where I was staying. And so eventually, God led me to pick the one in Dallas. And so I moved to Dallas. And at this point, my son was 3 months old. So I went to dental school with 5 kids. all under the age of, I believe my daughter was 8 years old. My oldest daughter was 8 years old. My son was 3 months old then. So I had 5 kids. I went to dental school, and I couldn't tell you today that it was the hardest thing I had to do, but it's still one of the most rewarding things I did.
Wow. I mean, just with 5 kids alone, that's just like, wow. Because it's not a piece of cake. And with 5 kids that you have to attend to, we commend you. And we thank Dr. Pham for her inspiration. So now, Dr. Chi, tell me now, you talked about you had a lot of dental anxiety, and you end up writing a whole book about, defeating. First of all, you said overcoming dental anxiety, and then this one, defeating dental anxiety. So what was your life like? I mean, what actually created that kind of anxiety that you were feeling? Because I believe that your story is not one of a kind, I'm sure. And we do know that a lot of people, fear going to the dentist because of dental anxiety. So what was it like for you?
So when I went to dental school, initially, like everything I've done was purely academical at that point, right?
Right.
I figured out at some point that I love this not because I really love teeth, I still don't, but because I love people, right?
Right.
And so, and that's why if you see me at the airport, don't show me your teeth. I don't want to see it. I love people, and before I do any treatment, I usually talk to people, and that gives me the people perspective in the whole thing. So at the end of the day, it's trying to help people, right?
Right.
So, but originally, like I said, I'm from Nigeria, and I'll never went to the dentist. Okay, my parents never took me. And Dr. Pham, the reason why I met her was because I used to take my kids. I still didn't go, right?
See, yes.
And so it was just the fear, one, of like, if you lay me down, what if I pass out? Then what's going to happen to my kids? But it's mostly a fear of unknown. And I think that's what most dental anxiety is based off. You heard that root canal is painful. You heard that implant is painful. You just don't even know what that was. Or like somebody took you when you were 3 years old and you were afraid, right?
Right.
So for me at this point, I needed to conquer that fear for myself, right? So I had worked in a corporate office, and the thing about working in corporate office is that they bring the patients to you. Dr. Mukanga, we just go in there. They say there is people on the thing, and you just walk on them. If they walked away, that was great, but that was what you were supposed to do today. You come out, you made your money, you didn't make your money. But when you open your own practice, you have to really own it. And especially when my practice goes after my first name, because there were a lot of stuff that I saw working for a corporate office that I didn't want to repeat in my own office, right? I wanted something different. I wanted to really treat people. I didn't want to treat teeth, right?
Right.
So I was sitting here, I went to school in Dallas. I worked in Dallas. I never really worked in Houston, which is where I am, Missouri City to be precise. So my office is located in Missouri City, Texas. I never really worked on anybody here. So there wasn't like any old patient that saw my great work, to come over. And so I needed to understand this dental anxiety. Everybody had taken different specialties. You were a cosmetic guru, you were a tooth pulling guru. I said, I wanted my own niche. I wanted my own thing, right? I wanted, and every time when I joined Facebook eventually, because I never joined Facebook before, people were like, oh, I went to this dentist. So I kept hearing what people were afraid of, right?
Oh, yes.
Yeah, so I wanted to be that person that helped them. I didn't just want to be somebody who fixed their teeth. I wanted to be able to get to know the people.
Right.
So in between not having that many patients, so I figured, what was I going to do? I started writing this book, right? And the first one I was going to write it, which is the first thing that I did, overcoming dental anxiety. I wanted to ask the question, what is your fear, right?
Your fear.
What do we even have to deal with? So it had a workbook where people had a whole lot of stuff they had to say. So whenever people walked into my practice, I would hand them this book free of charge.
Wow.
Just so it can help you. It can help you and me. And I needed to do my own teeth too. So I needed to answer this question for myself.
For yourself, yes.
For myself. So I started doing that. And then other dentists in the area started referring their patients to get this book so they could go over what was really wrong. And so That's how the first one started, right?
Yes.
And then I wrote that, and when I got those questions answered by a whole lot of people, in 2020, when COVID hit, right? I had a whole lot of time in my hand. That's when I wrote the defeating it one, right? The one that you have in your hand. It was just a compilation of the questions that people answered and my unanswered questions that that led to that book. And so today, most of the patients that I had from that earlier one, those are still, those are the people that I kept, and they kept telling other people about this. And so I feel like it was a necessary tool for me at a time. And I really enjoy working on people that have anxiety, because it's just not, you kind of need a kind of patient, right? And I figured I have 5 kids, I can do this. And so that's kind of where all of that came from.
I'm so glad that you actually came up with a book, because dental anxiety is definitely one of the reasons that causes people not to show up at the dentist, or postponing, and then, finding themselves in a situation where they now have to go to the dentist because maybe they let something go, out of whack for so long, and now they're in pain, now the face is swollen and all of that. So, doctor, so as far as you having a dental patient, I always remember this one patient particularly who was extremely anxious. In fact, when she came to the office, she came with one of her family members, and she initially did not want to hear anything about any other teeth than the one that was actually hurting her. So we actually took that route. We did, do all the x-rays and everything, but we only spoke about that one tooth. She came back with the same family member, treated the tooth, and then after a while, she was able to come. We were able to finish all the treatment, and then she starts rolling down the office on her own with a happy smile. So, what are some of the techniques, or what do you say to someone who is very anxious when they come to the office? How do you steer them towards actually defeating this dental anxiety, Dr. Chi?
The first thing in everything is communication. Right. You have to really understand where this patient is coming from. Right. So once you understand where the patient is coming from, sometimes I have to really say the thing that they said back, just so they understand that I understand what they're saying. Okay. Communication is the key. And the second thing is, everybody wants to be heard. Right?
Everybody.
Yeah, them telling you okay, hey, my teeth hurts, and okay, your teeth hurt. They don't really know that right? But they want to feel heard, right? They say, well, when I was 3 years old, somebody was pulling my baby tooth, and as irrelevant as you think that is, because you still have to make sure that they understand that you understand that, right? Before you can kind of talk over them, they need to understand that you understand what they're saying, and then to address that issue that is their main concern. You cannot say, well, I see how you think this is too, but this is not a thing. That's you can use that for them. Everything at that point becomes a thing, right? Until you get the communication across, they feel that they are heard. Those two things have to be paramount in whatever you do, even if you're the most skillful person that is on earth, right? If I don't feel like you heard me, I may not want you to treat me.
Correct.
Do you see what I'm saying? The patients don't usually know, you have to be able to understand them, and then you can give them options. Don't trap them in a place. Give them options. We can do this or that. And in this thing that we're going to do, even in those options, this is the benefit of this option, this is the benefit of the other option. Right. Communication is the key, where everybody feels that they are heard. Right. Okay. And you are understanding. And then you have to be, we took an oath, okay, to be, compassionate.
We did.
Yeah. And so some people, they just put it like a compassionate dentist without knowing what that is. You know what I'm saying? We have to really practice that. When you say you're compassionate, put your mouth where the money is. It does take a little bit more time to work on somebody who has anxiety, and you have to make sure that that it takes time. You can't rush from this to another one.
Right.
And so when you have a practice like that, like in my practice, I allocate a certain amount of time, and I let them know that they can tell my staff so that we know how much time we can block out of that schedule, just to make sure that they are heard, make sure that we're compassionate. So those are the key things before we go down into, the little other details. Yes.
I really, really, really agree with you. And it's very important. In fact, last week in our little talk, we talked about communication and how communication is the key. The doctor has to be heard, but most of all, the patient has to feel like they are heard. And, sometimes patients don't feel like they're heard because they feel like, they're talking, but they're not really heard. So it's very important for them to feel that they are understood. And I mean, they are owner of their own body, so they do know how they feel. And so it becomes very difficult even for a doctor when the patient does not communicate or say how they actually feel. And yes, you're right, because many times, I like to hear the story, like you said, and they start talking about when I was 3 years old. When somebody say, I had a bad experience, tell me a little bit about it, because that I feel like actually releases even a level of anxiety to where they can start feeling a little bit more at ease.
Yeah. Another thing also is for me, because I'm a Christian, right? Sometimes I have to stop and pray. And I've had people who say, "Don't pray for me. I'm not a Christian." I said, "Well, I'm going to pray for me." Listen, and let me pray for me so I can get over this. Sometimes we just need to pray, and sometimes even it's not even about the teeth. Okay, the anxiety is from a whole bunch of other stuff that you need to sit there and listen and say, "Okay, well, it says let's just pray." Okay, and it may not be about it, but let's just pray about that man that left. Okay, let's pray about that kid that is not doing well. Let's pray about that nice sleep that you didn't get. It's just what we do is a little bit holistic if you want to dive into anxiety. Right. It may not always be about it, really. And we have to remember that.
Right. And I absolutely love what you said, that you didn't want to just treat teeth. You wanted to treat the person. Yes. So now that's the level one, the number one important thing to know is communication. Now, when you're in treatment and somebody is, exhibiting some type of anxiety, what kind of treatment modalities do you offer them, so that they can alleviate or their anxiety can be alleviated and they can be less stressful?
So, at the level one, you can offer them at least nitrous oxide. Nitrous oxide is an anxiolytic, right? And there's other level that you can go down and put people completely to sleep. As good as that is, right? I also tell them, and we can get there. As good as that is, but it doesn't make for a repeated dental appointment, right? Because putting somebody to sleep is, so when you come for your cleaning, it's expensive as it is, right? But it's also doesn't make you come all the time because of the money, because of the fact that you're not even there. We want to get them to the point where we can at least give them like nitrous, give them a little bit of some anxiolytic medicine to start with, right? We can get there, but to the point where we explain to them that they're going to have to be awake to do this thing. That's the only way you can know if we have defeated this thing, right? Because if I put you to sleep and you come, and the next time you come, you don't even know that you've defeated it, right?
Right.
So the thing that I use as an example is, because I'm a mom, so I've had 4 C-sections. Okay.
Wow.
So when you're having your baby, right? You they numb the area, right? But you're still awake.
Exactly.
You kind of like see your baby being born, right?
Right.
So we say, okay, we're going to try to numb this area that we're going to do this procedure and still keep you awake, right? That way you can experience the fact that you've conquered this thing, right? So we want to get them to that level. But like I said, there are different levels of it. That the end of it is like complete sedation. But if we can avoid that, that would be okay. But I mean, some people are there where that's the only thing they can do. And that's like a few of us. But before we offer that, can we offer recovery where we can at least numb the area, do some anxiolytic medicine, and see if we can do the dentistry? Because at least, if you have a dental insurance, right? Your dental insurance at least mandates that you come in at least twice a year, basically, right?
Right.
So are we going to be giving you complete sedation twice a year?
Right.
That's a little bit too much.
It is a little bit, just a little bit.
You know what I'm saying? Yeah.
Right.
And the amount of medicine you can put in somebody to put them to sleep all the time, that's still a little bit. In this age where we're trying to be organic and trying to, live healthy, I don't think that's really very healthy, Like I said, there's a level to that, but it's just there are so many things we can do before we get there. And my goal is to get there before. Is to do other stuff before we get there.
Right. So do you feel that when you coach people through their anxiety, you feel that they become better recipient of treatment?
Yes. I think for me, I can say without being too exact that I'm at least 90% successful into getting people without having to put them to complete sleep.
Right. Would you please walk me through like a story of somebody that you could remember from the top of your head that was anxious, the steps that were taken in and how they are now?
Yeah, I remember a patient, right? So I remember he and I remember a she, but let me go with the she. Okay. Now there's a lot of people, but anyway, so this person has never been to the dentist in like 9 years. Okay. And you know the story, they have like broken teeth and all of this. And my main thing is I always like to save teeth, okay? And the procedure, when you do extraction, I feel like extraction takes a lot of people over, really. Okay. So if a tooth can be saved, and I do a lot of root canals, if a tooth can be saved, we did a root canal on this patient. I usually start with the root canal, even though I know I have to extract some teeth. The reason why I do that is because in a root canal situation, you can always numb the patient, go in and numb the nerve completely. You can get successful at that, right? Because in extraction, there's still going to be a level of pressure, right? That some people can't differentiate between that and pain.
Right.
So for somebody who is anxious, when you're still doing extraction, they may still feel a little bit of pressure, and some of them can term that as pain because they're already, into a lot of pain, especially if it's a tooth with a lot of root. Right. So, but when I do a root canal, which is the one, right?
You said when you do a root canal?
Doing a root canal first. Yes. I'll get through doing a root canal because I can get that done painlessly, right? And so on this particular patient, I took one of the teeth. I said, what we're going to have to do, don't forget about the crown. We're going to come back and do a crown, but we're going to do a root canal. And the good thing about a root canal is once we're done, most times, not all the time, maybe about 90% of the time, you can get the pain away, right? So I got the root canal done, and they went home and they felt relief from that too.
Right.
See, now they're starting to get a little bit of confidence, right? Then we go back and we talk about this pressure that's going to come. Now they know the difference between pain and pressure, and we go ahead and we take out the tooth, and then we, clean up, and then we go down and we do a deep cleaning, and we get all that done, and now this patient comes in. So when we got all the stuff done, did the fillings and all of that, now whenever she comes in and we're only just doing a period maintenance, right? She's like, is that all? So they're now excited to come, right?
Right.
And they even got to the point where they got to teeth whitening,
Right.
And now that's the reward.
Yes.
And now they're referring their their parents, their grandparents. I have people in my practice that I see the grandparents, the parents, the grandkids, the kids.
The whole family.
Yes. And that's what's good about, family dentistry that I love to
Right. So yeah, I absolutely love that. And it's doing stuff. Sometimes with people who are very anxious, we recommend doing things in stages so that,
Yes.
they can take it a little bit at a time. Obviously, if you go and completely sedate them, yes, then, you want to do everything so it doesn't happen all the time, or as much as you can. But like when you want them to actually defeat, you want to go in
Yes.
steps, so that they can actually every time kind of like regain confidence. And I believe that's how they can end up, being happy, regain their own health, their smile, and even their, self-esteem. Talk about mental health. There's a lot that happened. I like
Yes.
that in this book, you talked about also like understanding the importance of dentistry or of oral health, because I believe walk me through it. Like, why did you want to write that in this book that talks about defeating dental anxiety?
There's this thing I use for marketing sometimes, and it has this guy that has no eyebrow, right? And then he has
Yes.
he has one tooth missing, right? And when you look at his face, the first thing you see is the missing tooth, right? Is that one miss? You don't see the eyebrow until you look hard, right? So I know as women, we go get our eyebrow, we get our eyelashes, and we get all these things decked up, get the hair. But if you're missing a tooth, that's still what people see first.
This
You
is
see
true.
what I'm saying? So it is very important. It is very important in your self-confidence. So if you are worried about your self-confidence, I think you need to consider dentistry seriously.
I agree.
So to me, that's why I put that there. And so there are other things that we think matter that don't really matter. And I know people out there, they're willing to, seriously, they will be willing to put an eyelash or whatever before they get their cleaning. And especially when they're coming, you're going to charge that much for the cleaning? But then they'll pay that to the eyelash lady. So that, is a thing for me. But anyway, yeah. So
They
I
don't.
think,
They don't understand that there's a tight correlation between your oral health and the rest of your body. So you're not
yes,
doing yourself any justice, not fixing, your dental issue. It can catch up with you.
that too. And, so here's another thing. So most of the disease that we have actually get into our body through the mouth. Here's why. If something goes into your eye now, you blink and it's just very uncomfortable, right? Your ear, very uncomfortable. Your nose, very uncomfortable, right? But
Right.
in your mouth, a whole lot of stuff going. And for all the people that tell you that they don't want to clean their teeth because they've been brushing, and you show them a picture of what the mouth looks like, and they're like, oh, that's just tartar. No, that is a whole lot of bacteria that is just sitting there causing you some kind of disease that you could have avoided.
Right.
A long time ago, just by cleaning. There's just a whole lot of stuff that is just those bacteria that just go through your mouth that we are not aware of. And that's why I wanted to bring that to light, just so people can see that the whole body is actually connected. And the mouth is a very big pathway for a whole lot of stuff to enter the body.
Well, thank you so much. Thank you so much. Another question I have is, what do you do about an anxious child? Since you are, a family dentist, when you have children who are anxious, what do you do? How do you handle that?
So the anxious child is a different category altogether, because there is a whole lot of unknown that goes into a child. And most of the children that I've noticed also that most of the children that are anxious, the anxiety came from their friends or their parents.
Yes, yes, yes.
So those two people are there saying things that they probably shouldn't be saying, right? So the way to also get that child is to instill a level of confidence where they believe you, right? More than they believe the other people talking.
Right.
So I've had to take a little bit more time in a child, you can just start by doing the cleaning to tell them that it's not as bad, right?
Right.
and then gradually working your way through. And in a child, I think that the nitrous oxide comes in very handy.
Very
It
handy.
works on the more than it works on an adult sometimes, right? Because
Right.
they don't know a lot of stuff, but then their body is more prone to, taking a lot of stuff too. So with nitrous, which has no side effect whatsoever, you can start there, but you have to start with just cleaning without even the nitrous, just cleaning, and then asking them how they feel, how was their experience today, just that, and then walk your way down to the regular treatment. So I know my kids, and there's some boy that comes into my mind now. If he watches this video, he knows I call him my son. And when him and his mom came to my practice, I remember it was on a Sunday morning. I had all my kids were coming back from church, and the mom messages me through Facebook, and they sent me a picture, and the face was swollen badly. So I walked into my office with my kids. I prescribed an antibiotics, and so eventually I had them come on a Monday or Tuesday, and we couldn't get the treatment done that day. The first time I almost felt defeated. I told the mom, because that boy is one of the smartest kids you've ever known. You have no idea. So I felt defeated the first time. And I said, I wanted to refer the kid to a pediatric dentist. But I said, I'm going to try again, because I don't know anybody who has as much patience as I have, because I felt like that kid was one of mine. I said, to myself, having 5 kids gives me an edge that not even a professional has. The point is not in getting this treatment done, because it's not as hard, but it's in getting through to this boy. I said, I told the mom, I said, I don't want this boy to be treated as a number. Let's try this again. So the next time the mom she came in with a whole lot of essential oil. The essential oil almost put me to sleep. But, we had essential oil, we prayed, and we got to work. And I got this boy done till today. She's still my boy. I think he's about like 10 years old now. So anyway, so whenever he comes in happy now. We went over oral care, and he does well in his brushing, and we haven't had an issue since then. So it's just about that confidence, making sure that people feel heard, and and treat them like your child.
Exactly. Treat them like you would want to be treated, with patience. Yeah. All ears. Thank you so much. This was so valuable. I truly, truly appreciate you being here. And I feel like our audience will definitely benefit from this. And yes, if you are one person who feel anxious and going to the dentist, please purchase this book by Dr. Chi Emba, Defeating Dental Anxiety, and she has the workbook, which is Overcoming Dental Anxiety, and it will do you much good.
Okay, so the books are actually on Amazon, but there's also a link that has Dr. Chi's books where my books are. So it's just a website that says Dr. Chi's books. You can just order it through there as well.
Thank you so much for updating that information. So Dr. Chi, how can people, if somebody is in your area in Houston or Missouri to be precise, or even the surrounding area, because Texas is so big, how can they find you?
So I'm located on Highway 6 and Siena Parkway. So we are located in Missouri City. Our number is 281-778-9261. And my website is CHIFamilyDental.com.
Thank you. And can they find you on social media? Remember you said
everywhere. So it's Chi Family Dental on YouTube, Chi Family Dental on Instagram, Chi Family, I think, on Facebook and everywhere else. It's just Chi Family Dental.
Wonderful.
Every other handle that you can think about, even on LinkedIn.
Wonderful. I'm so glad you stopped by. It was so nice having you. I'm very, very certain that many people find a lot of relief by listening to this show we just had. So if you are in the Dallas-Fort Worth area, I'm Dr. Valerie Mukanga with Healing Wings Dental, and you can give us a call 972-213-0202 or on our website healingwingsdental.com, and we are located in Arlington, Texas at 4101 West Green Oaks Boulevard, suite number 317. So there you have it. We, as usual, wish you a very, very blessed day, and do everything you can to defeat your own dental anxiety, because you're able to do so. Many people have overcome it, both in Dr. Chi's office as well as in my office, and I do trust that you're one of those that will defeat dental anxiety. That being said, we wish you a great day. Bye.
Thank you so much, my sister, for doing this. I wish you success, and what you're doing is really amazing, bringing all the healthcare together, and may God bless the work of your hand in Jesus' name.
Thank you so much, and I say amen. Bye now.
Bye.